So I first met Colby in 2013. He had just undergone elbow surgery to reconstruct his throwing arm's ligament. And he was trying to return from that surgery, but he was unable to do so because of his hip.
It was real tight, and I couldn't get, a lot of, it started to limit my my movement. I noticed it after every time I pitched. It was affecting my arm, and I couldn't go out and pitch, and my elbow started hurting again.
Early arthritis does occur quite a bit in athletes, but to see it to Colby's level, where he's still pitching at a high level with such an arthritic hip, is pretty unusual.
Our team doctor goes, I can go in there, shave the spurs down, and get you a little bit more range of motion. You might get 5%, 10%. He says, but all your pain's going to be there because you're bone on bone. And he said, if you're thinking about playing any more baseball and without hurting or anything, he says, I recommend a hip resurfacing. And I said, okay, so who would you recommend? He said, well, the only guy that I know and that if I would recommend anybody, it would be Dr. Su.
Colby's livelihood and his passion is pitching, so there really wasn't any way for him to continue doing so without treatments.
I told myself, I said, if I ever want to have another opportunity of playing, this is the only avenue that was available.
So this is Colby's preoperative x-ray. On the left hip, we see a nice contour to his ball and the socket above it with a space in between, and that's the cartilage space. On the right side, however, you can see a big difference in the cartilage space. So instead of having this nice even space all through the joint, he's touching bone to bone right over here. And in addition to having bone-on-bone arthritis, he formed a really big bone spur here. Down here, we can see the hip resurfacing. This is his post-operative x-ray, where you can see all the bright white is the metal part. So there's a socket part here, and there's a ball part over here. And basically, it's a relining of the joint with two metal pieces called hip resurfacing, which allows us to create a new joint surface. So he has much more range of motion, and his mechanics are greatly improved.
8.5 months out, I was able to pitch on a big league mound.
Well, Colby's really a pioneer. So he's the first professional pitcher who's gone back to pitching with a hip resurfacing. The major advance that I would say has allowed that to happen is the procedure itself, where we're saving most of his bone anatomy.
They're asking me, why is this, I said, well, because I'm not pitching with pain, probably.
Colby and other athletes have shown us that it is possible to perform at a high level, even with an artificial joint.
Now, not having any pain, not having any soreness in the hip area, just daily activities, getting down on the floor with my kids. Before, it was just, something that I just didn't want to do because it just hurt. And I wanted to try to save that little bit of pain or whatever when I had to go out and perform, To have that type of knowledge and to be able to do it and do it right the first time and get it done and put athletes like us back into their form again. It's I'm definitely thankful. So
it's extremely gratifying anytime I can help a patient return to a pain-free lifestyle. For Colby especially, because it's his livelihood, and to be able to see him ignite his passion for pitching is extremely gratifying.